Welcome to the Mental Insights Podcast, a conversation aimed at understanding all sides of mental health, addiction recovery, and homelessness. Each interview will include one's personal experiences and insights, or an expert's advice and knowledge within one of these fields. The goal is to promote awareness, guidance, and support for anyone who is affected by these challenges. Thank you all for listening. Welcome to the Mental Insights Podcast. This is your host, Brendan Cutuli. We are here today for Season 2, Episode number 7 with Joseph Okoye. Joseph is a psychotherapist, counselor, and pharmacist who works at Rekindle Counseling and Therapy based out of the UK. Joseph uses multiple therapeutic approaches to assist with medications treatment needs for those suffering from mental health challenges. Joseph joins the Mental Insights Podcast to speak about depression and antidepressants through his own experience within the work field. Joseph, thank you for taking this time out with me today to be on the Mental Insights Podcast.
Thank you for having me, Brendan. It's a pleasure.
Wonderful, Joseph. Well, I'm really excited to get your perspective because you do have the opportunity to share from multiple sides, whether it's being from a psychotherapist aspect or as well from a pharmacist. I think normally I haven't really conversed with people who have both of those perspectives. So it'll be good to really dive deep into these two conversations. Specifically within this part, we'll speak mostly about depression. And within this, I just want to bring about the topic of conversation being from the Mental Health Foundation stated that in 26 countries, depression was the primary driver of disability. So this is something that's really causing a lot of challenges throughout people worldwide. Can you express what depression is and what are some of the symptoms within depression?
Well, it's interesting that a year ago I was reading our WHO statistics on depression. And they said that in 2020, depression will be the second most disabling condition. I mean, we're in 2020 already, which is quite when we talk about 2020, then it sounded so far away. Mm-hmm. So depression is very prevalent and very disabling, and there's so many causes of depression. It could be psychological, it could be genetic. It could also be due to events that have happened around people, like serious heart condition like stroke or heart attack or chronic illnesses. And so there are quite a lot of different reasons why people can get depressed. And the symptoms also vary. I mean, every day there's constant changes in the symptoms and what depression looks like. The classical symptoms are what we all know about: loss of energy, loss of interest, feeling low, and stuff like that. But it's a question of how often the person have had it. So if they've been feeling like that, say for a couple of weeks constantly, then it's time for them to consider seeing their doctor or their GP to have a conclusive and definitive diagnosis. Lack of appetite, waking up so early in the morning, or sleeping too much, gaining weight or losing weight. And so there are quite a lot of symptoms that could be that people can present, which will indicate that they're probably depressed. But like I said, this needs to be conclusively diagnosed before the person can now say, yes, I'm depressed, before they now go on to therapy, either whether it be psychotherapy or therapy through medications.
Thank you for that. And it's a great point that you made that, you can't really self-diagnose yourself if you are feeling some of these symptoms. It's getting that diagnosis from a professional and taking those steps properly of, maybe once you see some of these symptoms, then to reach out, then to seek those effective measures. And, you spoke a little bit about, and we know you are a psychotherapist, but can you speak about some of the effective therapies in treating depression today?
Right. So again, depression could be mild depression or moderate depression or severe depression. Um, it depends on where the person is classified. So if somebody has a mild depression, psychosocial treatment and support could suffice. But if it progresses to moderate to severe depression, then that won't be enough. The person needs a combination of psychosocial support, psychological therapy, in addition to medication. So you've got under psychosocial support and psychological therapy, you've got CBT, which is very most common therapy. Everybody knows that it works. It's proven that it does work. And CBT is a very important. Psychodynamic approach is also important, where people look at what has been in the past, looking back in their past few years to see whether there's anything that could have triggered it. And so those are something to also to put into consideration. And like I said, if it's a severe depression, then a very urgent approach is needed. So sometimes electroconvulsive therapy, which that's a specialist approach where and a specialist setting because they need immediate attention and to tackle it. In addition to medications that could be injectable sometimes and long-lasting medications that can be given and monitored specially under a specialist condition. So therapy of depression, whether it's psychotherapy or medication, really depends on at what stage, whether it's mild depression or moderate depression or severe depression. So somebody can move from having a simple medication and then eventually, due to one reason or the other, that simple medication is not enough, or that simple CBT is not enough anymore, then they'll have to go progress higher to something more effective in addition to counseling or therapy or psychosocial support.
So you're speaking about multiple stages, multiple effective treatments for specific people, and you're speaking about whether it's mild to severe depression. So there's multiple approaches that one can take, and it's really all dependent upon the person's own experience, what they are going through. And, within that, can you speak about the steps that one has to take through therapeutic measures and, describe more of how it's not, you go to therapy 3 times and you'll be cured of this depression. Can you speak about how it's an ongoing process and what are the steps you take within a client to really change their life and change kind of their lifestyle rather than just trying to heal one part and then they're completely, healed of their pain?
Right. So for instance, I've always said it's always good to start looking for help. The earlier, the better. So if somebody is presenting with a mild depression, for instance, they need support from family and friends who can support them and help them and get through it, depending on what is the issue is. So they need to look at their diet, how they eat, what they drink, and look at their lifestyle. Are they overweight? Can they do anything physically? Think of exercise, think of lifestyle, think of smoking and how much they're drinking. And those little things will make a lot of difference. And so it's not a magic bullet. Nothing, once somebody has been diagnosed as depressed, it takes time to eventually get to a point where they're well. So I would say, it's always good from the word go to make the person understand that it's a serious condition whether it's mild or moderate or severe. And it requires effort both on the side of the patient or the sufferer and the therapist or the doctor or GP to work together to get them to a better place. And it doesn't happen in a day. I mean, if somebody has mild depression, for instance, and they decide to go for psychotherapy like CBT, then they will need at least 6 to 10 sessions at least to get to a point where they are better. So the milder the depression is, the less sessions they will need with the therapist to get better. But it's a combination of a lot of things, a combination of counseling, a combination of therapy, a combination of good lives, changing their lifestyle if there's anything that needs changing. And those work together, and it requires a lot of effort. And what I've always said is when people fall, or when I mean fall, when they have setbacks, they shouldn't feel so bad that they've got a setback. You know, they need to forget about it and look at how they've done and carry on, because today may turn out horrible. Maybe they wake up one day, it was a horrible day. It's encouraging them knowing that tomorrow could be a better day. And that they have missed, for example, one session doesn't mean everything is in pieces. Things can get better. That they have missed one session doesn't mean, you know, things won't eventually get better. It's about encouraging them, knowing that it's a slow, steady process, and eventually they will get there.
Wonderful. And, you spoke about some of the lifestyle changes that one could make, whether it's, within exercise, nutrition, there's many of these aspects, in terms of the way that nutrition works within the body and within the mind, how it's connected, and really how does depression affect one's metabolism? So like, what is the correlation between depression and nutrition, and what steps can one make if they need to make that change within their lifestyle?
Well, I think that, obviously, if somebody, for example, is an alcoholic, alcohol is what we call a central nervous system depressant. It works against what you need to get to where you are. So in depression, people have low level of serotonin, noradrenaline, and dopamine. So alcohol is like making the whole thing worse, because alcohol, like I said, is what we call central nervous system depressant. Eventually, it will only make things worse. And also some medications, or people who get into drugs. Some drugs are like that. They are central nervous system depressants. Even those that are stimulants is not good for somebody who is also depressed, because it can add to their already depressed state. So it can trigger them into getting into manic depression if they started abusing the stimulants and central nervous system stimulants. So drugs and alcohol is something that people who are going through depression needs to be careful about, because a lot of drugs have effect on central nervous system, and they will be working against the chemical imbalance in their brain, which already they're having an issue with as far as depression is concerned.
And we will speak more about the neurotransmitters, those chemicals that are, being counteracted and can be through many means, and the use of antidepressants within the next part of the episode. So we will dive deeper into that approach, which I think will be great to learn more about the way they can be, as you say, positively and negatively used, because some can have negative effects in bringing them into a manic depressive episode. Within the aspect of depression, everybody sees it as a negative. They see it as kind of a experience that is bringing them down. It's not allowing them to be their true selves. But within this, you're seeing it from a new perspective, and you're providing your clients a new perspective, a new outlet in order to take that next step within their life. And I want to ask you, are there and what are there for any positives that one can take out from an experience of a depressive episode? And, why can we use these as positives in order to, make that transition within our life?
Well, it's when people are depressed, um, obviously it robs them of enjoying life. It robs them of interaction with families and friends. It robs them of the pleasures, the things that they used to enjoy doing. So they know how they felt at that point where they're so low that they couldn't do those things. And so when it's one of those things to remind them that, for instance, you used to love to play football, you used to love to go out with friends, used to love to go out for movies, and all of a sudden you're withdrawn. And it's to remind them these are little things that when you make small positive steps, as you get away from that dark place into getting better, it's something to look forward to that you're going to enjoy. And also, a lot of people who have gone through depression, they have a story to tell. They are such a great ambassadors because they know they have experienced it, they've gone through it, they know how they felt, they know how low they went. And so when they eventually get through it, it helps them to support others who are going through the same issues and to better understand, because sometimes people who have gone through issues, when they see others going through it, they can better support them because they know what they're going through. And I think it's very important as far as mental health is concerned. People who are going through the issues or who have gone through it, different mental health issues, they are better, they have a very significant role to play in advocating for better mental health support in terms of health services, in terms of awareness, in terms of, breaking the barrier of what the misunderstanding of what mental health is all about.
I'm so glad you brought that up, Joseph, because this is something that I think is such a crucial topic within someone who's experiencing a depressive episode, whether, like you're saying, it's sharing your story, sharing your experience to help others. And, within this topic, it's kind of the root of community. It's the root of relationships. And I want you to just touch upon the importance of having friends, family, whoever it may be, rooted within yourself, because I think that sense of community, that sense of relationship can be something that can lift you up out of such episodes.
Yes. So the thing is, social interaction is key to combating mental health. It's so key to combating mental. In this day and age, I mean, for instance, I know we're talking about depression, but loneliness can lead to depression. So when we tackle the issue of loneliness, which is getting more and more prevalent, I know in UK, even we have many stuff on loneliness. That's how much importance they know loneliness is now. They do social pressing where people are paid to go and interact, go to swimming lessons, go to exercise lessons, because they know that loneliness is a killer. And it can move from that loneliness to depression. And that becomes a very downward spiral to go through. And so social interaction, family support, being able to, have one of the things I come across a lot is people, especially youngsters, sending me messages about what they're going through. And I said to them, have you spoken to your parents? They say no, they don't understand, or they don't want to listen to me, or they don't care. They're so busy in life. So social cohesion, interaction, even at home, is so key. interaction with siblings, interaction with parents, interaction in the community, social gatherings are so important in combating and helping to alleviate symptoms and symptoms of depression. And those are part of multifaceted approach that is very important in combating depression.
Perfect, Joseph. I appreciate that. It's community is something, the social interaction that is, deeply rooted within humans in general. And you can see why, we see this loneliness growing, as well as the, rapid responses of depressive episodes happening worldwide. And it's something that's, so substantial that we're seeing today. And what can be rooted as a fix is this community, the sense of community and relationship that we can have. We all just need to converse with each other and be more supportive and caring, which, could alleviate some of the issues and some of the challenges that we see today. So I'm so glad you brought that up. And I think this is a good point for the first episode to wrap up on depression. And within the next episode, we'll be speaking about antidepressants. You'll be giving your perspective as a psychotherapist and as well as a pharmacist, which you'll be able to provide numerous approaches to what's going on within society today. So I'd love to thank you all for listening to this first part of episode number 7 of season 2 with Joseph Okoye, and tune in to the next episode so you can hear more about Joseph's experience and insights within the field of antidepressants in treating depression and other mental health challenges today. So thank you all for listening.
Thanks for having me.
Thank you all for listening to today's episode of the Mental Insights Podcast. Make sure to reach out to today's guest or myself if you need any advice, guidance, or support in your life today. Please be sure to like, subscribe, and review to this podcast so we know what you thought of this episode. I look forward to being in touch with you all in the next episode. I hope you all have a wonderful day.